So I think we will start now because we only have 30 minutes for the plenary session. So each group, the facilitator, will be asked to feedback just a few key points for one or two of the questions. So then I will start with Gurguli.
Thanks for the opportunity, and I'm really grateful to ELF to make such a wonderful group I had. It was completely balanced from various perspectives regarding geographical, gender. We also have umbrella associations. So it was a very, very fruitful discussion, and I think it probably the time was enough for us to discuss all the important matters. We have touched upon, I think, lots of important questions and interesting ones to the patient community. One of them, I think, was the various applications which patients can use in various countries. However, we realized that although it might be available for some of the patients, some of the healthcare providers are not really happy about it, nor not accepting, neither would like to have or receive data from such kind of applications. So here comes probably the responsibility of patient associations to jump in and start some collaboration with these healthcare providers. However, on the other hand, there are also lots of other possibilities where patient association can jump in. And we learned how useful is the Zoom, especially after the game changer of COVID, where all the self-management and self-esteem of the patients were completely changed. What we saw previously, that most of the patients who were completely adhere to their medication were reluctant to visit the hospital, so they tried to find other possibilities, video conferences and other tools to get in contact with their physicians. Others also refrain from face-to-face medical checkups, however, turn to self-assessment and self-management of their diseases. There are lots of tools which can help for this. We talked about applications and various gadgets which might helpful and can provide very useful data. But the big question mark, whether the patients can use it, whether the patient can use tools, gadgets, or familiar, or really would like to get engaged with some tools. And we learned that some patient associations run nice Zoom meetings, where they can provide useful information for the patients, for instance, how to use spirometers in an appropriate way. However, Zoom was also a very good friend of us during the COVID, and it seems that this also continues nowadays in providing other support to these patients who are would like to be more open for self-management and try to make change in their daily life.
Oh, it's 3 minutes, just so you know.
yes, I know. However, the main message was actually of the group is that we need the involvement of all the stakeholders to make happen that patients are not only receiving the medical treatment from their physicians, from their healthcare providers, but have a holistic approach and care. There are lots of ideas how this holistic care can be provided. For instance, nutrition, daily supplements, other type of good practices can be involved. But it really depends on the patients, how they approach their condition and how active they are. I think that was within 4 minutes.
Yeah, it was a perfect summarized.
Thank
then
you.
I invite Naomi.
Hi everyone, thanks for having me, and thank you to my group for a really good and helpful discussion. So I've got I'll split what we talked about in two. So I've got kind of general self-management to start with. One of the kind of best things that I think came out of this was the idea that self-management doesn't mean that you're on your own. It means that you're empowered, and that looks different for everyone. For some people, self-managing effectively might still mean that they have quite a lot of clinician contact, but it means that they feel more confident in the times that they're in between appointments or in between check-ins. As part of that, we talked about mental health and how that might be a reason why people struggle to self-manage, but it's also something that should be at the core of any sort of self-management advice and programs that are put together by people who are offering support, as it's going to have a massive impact on how people engage with different services, how they view themselves, how they view their condition, and we know that it can impact things like breathlessness as well. So something that's really important to include. And as part of that, we talked about how it's important for people not to feel overwhelmed, and any kind of health related conversation can feel very serious and very heavy. But things like the laughing yoga that we did this morning, anything that adds a bit of silliness, a bit of lightness is really great. And I mean, fun is a great motivator. So if we can make self-management fun for people, then that'll definitely improve people's engagement and the outcomes that they get from it. In terms of, for those of us who are in organisations that are trying to deliver self-management support, we talked about some of the barriers, such as engaging with health services. As we're all from different nations, we talked about the different systems that we have in place with reimbursement and whether things get paid for or not. And so if we're trying to scale anything, then those sort of barriers are really problematic. And there's also a couple of examples of where things were supported during kind of the height of the pandemic, but then but then funding has been cut as things have started to kind of calm down. So that's, it just creates another barrier to overcome. And so taking that into the second part of the conversation about what's happened as a result of COVID, a lot of things have changed, perspectives have changed within the healthcare systems, and then also within patient communities about the positives of remote options and also some of the drawbacks. There have been examples of remote clinical trials and the similar technologies feeding into how routine appointments and routine care is managed. And this has changed the amount of data that clinicians have and how decisions are made. And also recognising that it's not for everyone, not everyone engages well with digital services. And moving forward, we probably need a hybrid model where people can choose what works best for them.
3 minutes. Sorry, 3 minutes.
Yeah, cool. And then the last point was just around for those of us who are delivering any kind of service and that's moved online and using platforms like Teams and Zoom, is that we miss some of the sort of personal chatting. It's difficult to speak to people, you don't get a lot of feedback, it's hard to read people's emotions. So it's not a perfect replica for some in-person services, but it's also better than nothing. It's more important that people have access to something that works for them. So yeah, that was, I think, a summary of pretty much everything.
Thank you so much. I'm sorry, I'm rushing. It's just I want everyone to speak. I invite Catherine now to join.
Hi. So I had a really lovely chat with our group. Lots of interesting discussion points, some of which definitely sort of echoed what we heard from the last two speakers. The people in the group were all very positive about the idea of self-management and recognised the importance that it has sort of moving forward with healthcare. But one of the points that was fed back that I found quite interesting was that the patient communities that they exist in and work with, that they believe that it's actually quite a small minority of people who are interested in self-management, and that the vast majority of patients would actually rather than the healthcare providers take control. And so it's sort of looking at how we can shift that attitude. But also understanding that some people just have different needs, and so we don't necessarily need to shift that attitude. And I think Naomi's just said about hybrid models, and I think that's probably something that seems to be of importance moving forward. Then I guess the big shift happened, which was the pandemic, and that's where this use of technology has really been sort of placed in our laps, and there's no sort of going back from it. And having chatted to the group, everyone feels quite comfortable with that, and no one feels like there's too great a barrier to accessing it, as long as there's enough time given by healthcare providers. And I think that is the main barrier to accessing it. But it's one that could be overcome if people work together to provide better information, whether that's patient organizations or if clinicians can ensure that they're giving plenty of time. I thought what was quite an interesting point was around inhalers. So a lot of the time when we're talking about self-management, we're talking about exciting new tech. But the point was made that inhalers are very rarely used correctly. And quite often when you're given an inhaler, you're given a leaflet and sent off and then expected to be able to do that. And that's such a key part of self-management for so many people. And so actually that even things that we've had for a long time, we need that time invested in enabling patients to use it correctly, instead of getting overexcited about having an app. But yeah, the apps also are going to have their place and work really well, but we just need to make sure that we are looking holistically at what we've got. And sort of one of the other barriers is that a lot of websites are just not accessible. They're not patient friendly, and the colors, they might look pretty, but you can't read what's in them and find the information you want. And that was something that came up as being a really important thing for organizations to invest in. Don't worry so much about how it looks, but do worry that the people you're working with can actually get what they need from it. So I think one of the points that was made by Chris, he gave me this lovely analogy of self-management being like a supermarket. So supermarkets, when he was young, you used to go in and you told somebody what you want, and the grocer would get it off the shelves for you, and he'd pack it for you, and then he'd take the cash, or she, and pass it over. And nowadays you go into a supermarket and you sort of scan your app and you check out yourself, and everything's done by cards. And that's how much it's moved from the sort of tech we use in our daily lives. And that is going to now happen with self-management around healthcare issues, especially post-pandemic. Okay, I'm basically finished. I really wanted to get that in because I just thought it was a really good analogy. Like, we've all learned very quickly to adapt to it. However, we need to make sure that we don't leave people behind, and that's where we need to invest now, really, to make sure that everyone feels looked after.
Yeah, thank you so much, Catherine, and your group. And I will now invite Stefano.
Yes, first of all, I would like to thank all all my group, because I was kicked out before thanking them, and they were a wonderful group. I was very happy to talk with them. At the beginning, I wanted to do a question related to the topic of GDPR and the privacy, which usually is a big barrier every time we talk about digital health, which is related to what we are talking today. And I could say that our group is very confident, and so they don't have all the fears and the problems that most people have usually when we are talking about sharing data and so on. Well, regarding the other questions on the self-management, I found very interesting what Carlos said, because their federation made work of co-responsibility. They are making a lot for patient, but they need co-responsibility from the patient. They have to show that at least that they are adherence to what they are doing for that. Otherwise, they are not kicked out, but they are helped. They are moved to another group with a psychologist that can understand why they are not doing the best for curing themselves. This was very interesting, in my opinion. We talk about the problem of the funding, because at the moment it's all in charge of the association, but sooner or later I think that the healthcare system should in some way, help in the cost also of digital devices, while Carlos prefer the that private company help in funding this. Let's go to the second question about the barriers, and the barriers are always the problem of mental health, because people have to accept the change and have to be the first people who have to help himself. So this is the biggest barrier. Regarding the changes after the pandemic, I have just to find a very funny things that was said, that Lilia said that the French population have learned to kiss less, and she would like that they go on like this because it's less infections for us. Thank you.
Thank you, Stefano. And I will invite Olivia. Yeah. Okay. Or maybe is Kat's group active?
Yeah, I'm here.
Sorry.
Should I go ahead? Yeah, so thanks to my group for a really interesting discussion. The others have covered a fair few points that have come up already, so I won't repeat what others have said. One thing that was really interesting to me in terms of unexpected consequences of self-management was, for a little while, we spoke about a sense of grief for some people if they've been unable to do activities that are meaningful to them for some short time, and then a short rehab program enables them to do those things. People said there's a lot of self-blame, and that needs to be addressed, and people need to be supported through that. Related to that, and another kind of psychological aspect, someone raised that people with respiratory conditions and loved ones sometimes fall into kind of a pet carer patient dynamic, and bringing other professionals and kind of other actors into that can trouble that dynamic a bit. So there needs to be kind of support there. In terms of kind of positive things about self-management, most of us said, people want education if service and information that are accessible to them are promoted, but it can be hard to follow a self-management plan if it's not created and shared and talked through in an accessible way. It's not just what the message is. Someone said it's who says it and how. So it's really important to work with people and with their loved ones to co-produce advice. And one person said what was really useful to them was having some solid examples in their kind of self-management plan for what you might do in specific situations, because it was all kind of very abstract and terms weren't necessarily defined or explained. In terms of negative experiences, one person was quite keen to get family involvement in self-management, but found that there was pushback from patients with that. They didn't want their families involved. We talked about the difficulty of moving from child services to adult services, and taking a more active role in managing your health, and the assumption that young people will just know all of this when actually professionals might have just been talking to their parents for the last few years. We thought that remote could be challenging in terms of not being able to see what's going on physically with people or take measurements, but that WhatsApp and Zoom made things much more accessible. In terms of barriers, yep, lack of access to services, whether that's due to geography, long waiting lists, costly services. For charities, it was kind of money and resource, not fitting self-management plans into people's daily lives and kind of explaining what that means to them. Lots of people have, you know, time commitments, care responsibilities. I think the average reading age in England is probably around 11. So information is just not accessible. And there's a really interesting conversation around the cost of living crisis and the concerns that patients have about the cost of using equipment at home. And one of our group actually had had some experience with this in another area, and they'd created a chart that showed people kind of how much home devices, how much electricity it used, so they could see kind of how that was. I think that's my 3 minutes.
Yeah, thank you so much. And then I'll invite Liam.
Hi, everyone, and thanks to my group. Really empowered by their discussions and all the hard work they did during COVID and in other difficulties that are affecting Europe at the moment. I'm just going to run quickly through the 3 questions with bullet points. Basically, all had experience of self-management, either as patients or advocates, with all groups encouraging or providing some form of self-management. A lot of emphasis was on mental health aspect of whatever the disease was. And this was really sort of, they had real huge benefits seen by, you know, that sort of collective self-management, that peer-to-peer meeting face-to-face or being part of a Facebook group. So everyone was encouraging of self-management. Barriers were many and diverse. Obviously, the first one is individualism. Everyone's an individual, and what suits one person doesn't suit another. Logistics and provision of services. A lot of self-management has to be sort of imparted by healthcare professionals or by patient organizations who have that knowledge. So going to centers or not having a center there where you can learn about self-management is a big barrier. Disease impact and comorbidities. So like a lot of people are worn out if it comes to pulmonary rehab. The disease might make you want to go and do exercise. And also there's a sort of barrier there because it often takes a long-term effort to see the benefits of that self-management. Language is a big barrier. A lot of knowledge exists in silos. So there's a lot of patient organizations with useful information, but it's not available to other countries. So an action point, I suppose, and I know ELF are doing this, is all about translation of fact sheets. But there's also possibilities that local doctors could impart more knowledge about self-management to their patients if they had guidelines written in local languages, fact sheets written in local languages, or short translated videos aimed at primary care providers in local language, saying, you know, like if you've got pulmonary hypertension, the idea is not to sit around, but maybe do a bit of exercise, different things like that. Obviously, another barrier is digital exclusion. A lot of our self-management now is via technology, and not everyone is prepared to or able to cope with the digital age. Also, another big barrier is rare disease. So like that peer-to-peer support, patient organizations, doctor knowledge might not exist for every disease, especially ultra rare. And then also the limited centers of excellence. Again, coming back to the idea, if you're ignorant of the benefits of management, you're not going to do it. So like we need to encourage like much more sort of spreading of knowledge across the centers of excellence and down to tertiary centers. And then on question 3, like there was benefits from COVID, and we all changed different things. Digitalization, great efforts were made by patient organizations and great response back. Lots of reaching out by phone to those missing online. And all the groups did a lot of new things that was empowered by digital delivery. And lots of positives around digital health, but also that big worry about digital exclusion. And that's me done. Thanks very much.
Thank you so much. Claire, the floor is yours.
Hi, thank you. We had some really interesting discussions, and actually a lot of what Liam said we talked about in our group as well. So we talked a lot about the barriers to self-management, and the digital divide came up. And I think traditionally it's been seen that it's older people that struggle to engage with technology, but we also spoke about other groups as well. So for example, people who live in rural areas might find it a little bit harder. And we also talked about language as well, because a lot of the information produced for patients is in English. So we thought it was important that patient organisations offered a range of options to engage with people. So, for example, WhatsApp was considered to be a little bit easier to use if someone's got a smartphone than accessing, for example, a Facebook group or a forum. TikTok to engage with the younger people, because apparently Facebook is considered old hat now. But also offering things like a printed newsletter as well as an electronic newsletter. So I know that, for example, Tess's group do that. She wasn't in our group, but I've seen her newsletter. And also telephone contact as well, which was particularly important during the pandemic. We spoke about the importance of peer support. So not just in helping people manage, but also in helping people get to grips with technology. So can people who are a little bit more savvy about using technology support people who are less so? For that reason, we thought it was also important to engage with carers. Often it's the younger member in the family who might help the older person with their technology. And we thought it was important to differentiate between people who lack confidence with technology and people who are just not willing to engage with technology, and to be able to offer support for people who need their confidence building up and their skills building up. And that ultimately technology can actually open up access. So whereas organisations might lose some people if they're using technology to communicate, they may gain some people as well. So perhaps, for example, people with rare diseases being able to come together across a country, across Europe, and people living in rural areas as well. Another barrier we talked about was about people who are less well. So it's difficult to manage your condition if you're very ill, if you have a lot of comorbidities, a lot of other conditions that you're managing, you're juggling treatments for different conditions, mental health, which I know several people have mentioned already, but if you experience mental health problems on top of that, if you lack support, for example, you don't have a ready network of support, that can make it really difficult. And I think it was something that it was spoke that the ELF could have a role in, is making clinicians aware that many people with a lung condition are managing several different conditions, several treatments on top of mental health problems, because when you go to your family doctor, you probably have 10 minutes. So you're not going to be able to talk about all the different aspects of your life and what makes things difficult. So if clinicians were more aware of that, they may be able to offer more tailored support. Conversely, it was interesting that in our group, we had people who all work with people with lung transplants. And it was mentioned that when someone's had a lung transplant, they often feel so much better that they disengage with the group, and then they're lost then to the group. And also they're not available to give support to people who are going through that process. So that can be a barrier as well. And ultimately, we concluded that organisations need to adapt their support to an individual based on their particular circumstances.
Thank you so much, Claire. And now, Bess, the floor is yours.
Yes, thanks. In our group, Jeanette was so kind to take the notes, and she will provide you with the feedback. But we had a great conversation in our group as well. So, Jeanette?
Yeah, thanks, Baz. Yeah, we had a good discussion. I'll go through the 3 questions. A lot of the things have been covered before, but I don't think there's any harm in stating some of them again and reinforcing them. So for the first question about the experiences of self-management in our patient communities, the need for good information and education is really important. And it was particularly stressed that this needs to be two-way. So the healthcare professionals need to inform the patients, but also it's really important that the healthcare professionals are trained to give this education well and appropriately. So, for example, it needs to be tailored to the individual patients. And it was also stressed it's really important that this information and education is given at the very beginning of the particular therapy or device that's being used, so that it's clearly explained, questions are answered at that point, and the individuals can then become more confident users. We talked about the role of patient organisations and how it's key. Patients come to patient organisations for information about self-management, things around how to cope with breathlessness, looking for what techniques they can use, which does suggest a lack of information or the right type of information that they're getting, perhaps from healthcare providers. One of the key main points made really was that self-management is not about doing it alone and in isolation. It really needs to be a collaborative approach between healthcare providers and people with a condition. Another point mentioned was around people who have multiple conditions, and that then self-management may be even harder to manage and take on board, as getting the right approach and the treatment might be even more difficult for the healthcare professionals to identify and then to communicate it in a meaningful way. So we really need to find better support for this group of patients as well. For question 2 about barriers to self-management and solutions, I think it was Naomi that talked about making self-management fun, and we talked a lot about the need to make self-management less formalized. So I think this was a similar type of idea. So bringing people together in less formalized ways and using different approaches. So one example was to run a rambling group, which would provide physical exercise, but you're not specifically talking about self-management. Again, self-management needs to have an holistic approach. We recognise this isn't always the case. One person in our group talked about the experience in their country of the chronic care model, where treatment is mainly in hospital, and really feels that this model could benefit from being revised. It could work better on a regional community basis in their country. And then finally, question 3 about changes due to the pandemic. As I think everyone said, the benefits of technology using Zoom, an increase in telehealth, help to maintain communication. They were positive things, but we did talk a lot about health literacy being an issue. Not all patients are able or confident to use digital solutions. And also there's a real need for better tech solutions for self-management, as the video in Tessa's talk earlier really highlighted around oxygen use. Last point, a useful resource mentioned, which some of you may know about, was TechSoup, an international organisation that can help non-profit organisations with technology. And they can provide discounts on Zoom licenses, Microsoft licenses, etc. But yeah, I think they were our main points.
Thank you so much, everyone. And to the facilitator, please send in your notes and bullet points to the ELF staff. And we would love to hear you more, but we have the timetable to follow. But great work. There are so many common things, and we want the same thing. And if we work together as a team, all of us, we will then achieve goals. And self-management should be fun, but it's also very important for patients to feel well. I will now hand over to Kjeld.
So thank you so much, Mikaela, and everyone for this wonderful discussion. So you are indeed a wonderful, both diverse and engaging group. So it will be my pleasure to try in the next few minutes to sum up every point that you have made during this plenary discussions in a few highlights. So I think first and foremost, I want to congratulate also the organizers for choosing this theme, because it's clearly engaging for everyone. And clearly there's a lot of questions and information that needs more attention here. So I think one of the key takeaways for me is that self-management appear to be more of a team management, because one of the fears that has been mentioned is to be left alone, unsupervised in a self-management situation, and perhaps in some situations you wouldn't feel comfortable doing self-management. So I think we need to think about informing about what self-management is, and perhaps self-management is not the best term to use. Perhaps maybe something like co-management or similar would be a better term, because it explains that you're not on your own while you do it. I think there is a low proportion of patients that actually want to self-manage. So we can raise awareness in this area, and I think through these discussions we have been made aware that there's a lot of potential to raise that number as well, and to make more people feel comfortable engaging in activities like this. I think that there is a need to highlight the fact that all stakeholders need to be involved. So it's not just a choice for the patient. It's to a very large extent, it's also something that the healthcare provider needs to be prepared for, nurses and so on, the whole support apparatus as well. So from the healthcare provider side, there might be a need also to look into the willingness and ability of healthcare providers to be involved, and to look at data from apps and tools. I know some are interested in this, but it's also an extra task on their table to look at this, right? And we all know how tight time is at this moment. There are lots of devices and tools available to support, but we need training, guidance. We need more information about regulations and so on in order to engage with them. And here, healthcare organizations can also play a role. We need more time with healthcare providers in the sessions in order to be well educated on self-management. And perhaps there we also need to think about paradigm shifts, if there's room for educating ourselves and healthcare providers in order for to have less interface time in the future, or maybe interface through apps or other devices. There might be some mental health interventions that could be seen as a key part of self-management. So it's important that we also feel well taken care of, and people feel that their fears are met by constructive answers. Finally, there are significant barriers that could be, a few could be mentioned as the interactions with health services and funding and information, or sites not being really accessible at the moment. So all in all, a lot of potential, right, for us to engage with and to work on in the future. So that was a few points in a few minutes, some highlights. We will of course look closer and deeper into the feedback notes that you're sending in to us, and work on them as well. So we started the day with a poll, and I think we have a poll ready also to look at now, to see if any feelings or attitudes have changed during the day. So please engage. And I think we are looking for the results. So at least I'm very pleased to see that there are a few people who know a few more percentage-wise, people who knows more a lot about ELF, or know and know a little about ELF, right? So maybe we have raised the information about ELF as well. So how well do you feel about self-management for lung disease? There are around 60% that feel quite well informed, about 40% feel very well informed. And finally, how confident are you in sharing your knowledge of self-management with your patient community? 55% feel quite confident, 42% feel very confident, and 3% feel not confident. So there are some, we can see there are some improvement during the day, which was the whole purpose of this exercise. So thank you so much for all your engagements. Thank you to the speakers, and thank you for the facilitators who have been been organizing the feedback. And I see now we have a last poll also about future events. So if you just take a minute to also fill out about future events. And it appears we have the results. So what would you prefer then for the ELF Patient Organization Networking Day to be held? There are 45% that prefer in person at a face-to-face event, 38% online like today, and 17% has no preference. So that is quite even. So we might look for hybrid events in the future. Second question, how helpful did you find today? We have 59% saying very helpful, 38% saying extremely helpful, and 3% saying somewhat helpful. So thank you all for your feedback to today's event. I'm quite pleased to see the positive response. So thank you for filling in the form. We are 2 minutes over time, so it's time for me to thank you and thank my co-host Mikaela Odemyr. Thank you to the planning group for the day. That is Liam, Hilde, Stefano, Lilia, Sarah, Stanislav, and Gergely. So later this week, I will be traveling to Barcelona for the first face-to-face EIS Congress in 2 years. So I'm looking forward to see as many of you there as possible. And if you're there, I look forward to catching up with you, maybe at the ELF stands, maybe at the research seminars, maybe at the different talks, networking events with healthcare professionals and other old friends of the respiratory community. For those of you joining the Congress on site or online, I very much hope that you will enjoy it and take advantage of the many opportunities to engage and share the work of patient organizations across Europe. I would like to end the day with a small sneak peek, because every year at Congress we are handing out the ELF Awards. And for this year, we have awarded the ELF Award 2022 to Rosamund Adokisi Debra. She is the mother of Ella Roberta and the founder of the Ella Roberta Family Foundation. She has worked very hard to inform and advocate for clean air. She has a dream, I believe, that in a world where everyone can breathe air that is free from toxic pollution, regardless of where they live, their economic status, and or their ethnic background. And we have a small video to play you out with. So thank you so much for today.